Good afternoon. Welcome to Office Hours for this Tuesday afternoon, PM edition of Office Hours. I'm Pat Zemer, CEO of Magna. I'm here each Tuesday, 9 o'clock in the morning and 2 o'clock again in the afternoon to answer any questions that you may have with regard to Magna services, products, marketing service, certification, training, anything that you may want to know and discuss at that point in time. We're here to help you and answer your questions. So I'm here. If you have questions, go to the Facebook page, or if you're on the Facebook page, just simply enter your questions into the chat box, and we're just happy to answer any of those questions that you may have. I was on this morning. We had some very good questions that are available, certainly on the page for you to view that particular video of the morning office hours. I've got some questions that were presented to me today in a conversation, and I thought I would go over some of those with you at this time to potentially help you gain some additional knowledge as to how PEMF works and how the Magna Wave device works as well. So again, if you have any questions, simply post them there on the Facebook page, and I'd be happy to answer them. But one of the questions I've asked before, and it's because it's something that comes up a lot, and it deals with carpal tunnel issues, carpal tunnel syndrome, and how Magna Wave PEMF can be effective with that. Well, first, when we treat someone with carpal tunnel, what I often do is I'll treat the area that they're having a problem, the elbow, shoulder, and low back. Because we're talking about an area where everything's coming off of the spine, coming down your arm, going to your... So if you're having problem here, you could be having that same issue as a result of coming up from a strain that you've had somewhere else. Quite often it's a result here, but then it travels on through the nerves in your body and the tissue up into the spine, or where it makes connection with your spine, and we want to make sure we work all of those areas. So studies have shown, and this is from Dr. Rowan, his second opinion. If you've never taken a look at what Dr. Rowan does, he's a doctor that does extensive research, has a great newsletter that he talks about, and he's talked quite a bit and utilizes PEMF therapy in his practice. And his newsletter is called Second Opinion. So it's Dr. Rowan's Second Opinion. And that's where some of this information, after I was asked this question, I'm gleaning some of the information for my response from some of his information. I had an opportunity last year to meet and talk with him at the Ozone Conference held in Santa Barbara each November. And I'll be back there at the Ozone Conference this November as an exhibitor and talking to the various doctors. If you've not explored ozone and how it can be complementary to PEMF and other therapies, it's certainly something to take a look at, because it's a service and a product that we'll be making available as a complementary product to the Magna Wave PEMF. However, studies have shown that PEMF helps improve the pain of carpal tunnel syndrome by as much as 93%. Is it something that's going to make it so you don't need surgery? That has certainly happened, and there's plenty of people that have carpal tunnel that deal with it in various ways. But we've seen tremendous results. Studies have shown those types of improvement rates in terms of how much it's helped the pain relief from it. And again, like I said, we treat the area of the issue, the elbow, shoulder, and back, to get at all the areas that could potentially be influenced, or areas that influence the movement into your hand, wrist, and where you're having these kind of issues. It's not the kind of thing that is solved immediately. I mean, it can take a good amount of time. I mean, it might take a couple of months worth of treatments. As I've talked in the past, it took my wife 3 months worth of treatments to get to where she's got a situation now with her back that we only need to treat her a couple of times every 3 to 4 weeks to get that type of relief for 3 to 4 weeks. So I can't tell you that you're going to treat your carpal tunnel syndrome one time and you're good to go. It could take multiple treatments. Each person is different, depends on the severity, depends on what you're doing to not have the problem occur. I mean, that's where the whole ergonomics thing comes in. If you're doing something every day that's aggravating this and causing it to be a problem, if you don't stop doing what you're doing to aggravate it, it's going to stay there and continue. So that's where the right angles for your wrist and how you're typing or how you're writing or what you're working on, how that affects the issues that you're having. But a very good success rate in dealing with those types of issues. Again, if you have any questions, please feel free to answer them. Krista's on from Iowa. Hello in Iowa, from Kentucky. Glad to have you with us, Krista. If you have a question, please feel free to put it right there into the area. All right, so when we're dealing with that, when we're talking about rotator cuff and tendonitis of the shoulder, Dr. Rowan reports through some of his research and studies show that 80% of those who use PEMF have an improvement with their rotator cuff tendonitis and their shoulder issues, and that's really not unusual to see those types of improvements when those types of issues. Again, we would do more, certainly if it's rotator cuff and we know it's damaged and we know it's separated, then we can treat that area. But it's always beneficial to treat other areas that could receive referred pain from those injuries or can refer to those areas as well. But when it's very specific, then you can certainly work on the rotator cuff area. I took a fall. It's been about 3 months ago now. We were preparing to go to a trade show, and I tripped over a wire and took a fall and landed square on my shoulder. And I've treated it regularly, and it's much better. But I still have a situation that if I sleep and I'm laying on my right shoulder, that after an hour or so it becomes very sore. It's to the point that I can now lay over and the pain goes away almost immediately, which tells me that I've got it down to an aggravating state that I really just need to concentrate on it and do it a lot. So I've got a little pinch or something going on there that is very easily aggravated when I lay on it. And so if I get that to where I get to finally get that totally resolved, doesn't bother me through the day, only when I sleep. So if I can work on it immediately when I get up in the morning or work on it before I go to sleep for a period of time, I can probably, and I'm sure I will, get it to the point that it doesn't bother me at all. The problem I got is I don't think about it during the day, so I don't treat it as regularly as I should. And that's very important when we talk about PEMF and how we deal with it. Shelley, hello. Thank you for joining us. So that's when we're talking about rotator cuff. If you have any questions, these are issues that are certainly with humans that we're talking about, but you have the same thing with small animals with cruciate ligaments and hip dysplasia and muscle strains from they're so active they can strain themselves very easily, so they have back issues and arthritis. So the same types of situations apply, whether it's a person, small animal, or even a horse, cow, chicken, whatever it is we might be treating. And we've treated all those animals because they all have blood flow, they all need good oxygenation, and they all have issues that PEMF can give them some benefit from. Let's see. Oh, here, and another one that came up in the same conversation. What about migraines? We talked about this a little bit this morning. Ron asked the question this morning if he's treating a headache, can he put the coil right on top of the head and treat from that position? Certainly you can do that. And the migraine sufferers can expect total improvement in 73 with 45% of the users getting substantial improvement in just 3 weeks or less. A lot of times people who suffer migraines, it's a continual kind of thing. So yes, if I've got a migraine, can I help relieve it at the time? Yes, but if you do continual treatments on the area, you can get to where your migraines can be greatly reduced or even, I don't want to say eliminated, but you could get to where a point that it's not bothering you at all simply by improving the circulation in the area, improving the overall blood flow and oxygenation of the body. All of this comes from pain, headache pain as a result of inflammation, stress-caused inflammation, whatever, dietary-caused inflammation. A lot of people get migraines from various things that they do, or they know when they're going to have a migraine. They can feel it. They can feel it coming on. So if you work that continually, you can spread out those or even minimize how often you have them. And so, like it says, 73% of the people in Dr. Rowan's research of studies have shown an immediate improvement or relief from migraines, and 45% showed a continual improvement over just 3 weeks of use to where they were greatly diminished or the strength was diminished. So that's pretty good stuff to talk about when you're thinking about it. Here's a question. Sarah asked the question, I'm wondering if you've had much success with chronic pain from fibromyalgia. And the question is, we have. And fibromyalgia is a tough one. because of the way it affects the body and where it affects the body and how is the best way to approach it. But again, pain, as I was just talking about with the headaches, the pain is a result of inflammation in the body, wherever it is occurring. And so if you can treat those areas, and in this case, you might treat the area of the pain and the area around the area of the pain. I apologize if some of you have heard this before, but I kind of compare it to an accident on the highway. There's an accident, everything's jammed up around the accident, going both ways because everybody's looking to see what's going on, all the commotion of the rescue vehicles or the wreckers and all that stuff going on, and things get jammed up all over, even on the side roads. And it was incredible. We had a big concert here last weekend, and we were coming back into Kentucky, Louisville from over in southern Indiana. We were 30 miles out of town on Interstate 64, and it was almost bumper to bumper. And it was that way in all four directions on the interstates because of this concert taking place in downtown Louisville. And people were trying to get to this concert. And it was just incredible. I couldn't believe what it did to the traffic. But as we looked at it on our map, on our GPS system, that's where it all centered from. We use Waze, and so we were able to see where everything was jammed up as a result of that one area. Well, what we want to do, and what I'm talking about, is when we're dealing with these types of situations like fibromyalgia, treat the area, clear up the area around the concert, if you will, or around the accident. Then you got to clear up everything around it. So if the problem's here, we want to treat here, but we want to treat the shoulders, the low back, so we got a good flow of blood flow around the area to clean everything up. Yes, you can do the area specific, but you want to make sure you do everything at the same time. That's why we really talk a lot about full body treatments and how we can aid with that type of thing. But yeah, Sarah, we've had really good success with people with fibromyalgia. Not overnight. It's not going to happen in one treatment. Now, there have been people who do one treatment and feel much better and go on about what's going on. But a lot of times we're talking about stress, inflammation, and inflammation as a result of the fibromyalgia that's been there for a good while. It's into the cartilage, the tissue, the muscles, the nerves. It's everywhere, and you really got to work hard to get it out. So it can take some time, but is the probability of them having some relief there made available to them? I mean, we've seen some, anecdotally, we've seen some wonderful effects that people have been very appreciative of and have been able to lead better lives and get about the business of better taking care of themselves and allowing the body to better heal itself. So, great question. Let's got another question here from Krista. I read that if a tail of a horse is reactive, chances are they may need a chiropractor adjustment. Has this been your experience? Well, let me put it this way. Yes, that could very well be the case. What I've noticed over the years when I go treat a person or treat a horse, if I've got something going on and I'm treating them and I've got, let's say, a tail twitching or someone having shoulder or back issues, and I treat them once and it's a little better and it's better, and I treat them twice, it's better, I treat them 3 times, it's about the same, it's staying about there, then once I know that I've done something 3 or 4 times and whatever, they're still getting some reaction somewhere, then it's probably time for some additional outside support, whether that would be chiropractic or regular doctor or veterinarian, whatever it may be. There could be something else going on. Because what we typically see, if there's a soft tissue issue, we can work on it, it feels better, everything comes along, vet checks it out at some point, yeah, this is fine. But if you get a situation that it does not change in 2 or 3 treatments, you don't see any improvement or very little improvement, then that's the time that you maybe need to have a chiropractic type of adjustment or have it looked at from a chiropractic situation with regard to your question, Krista, about the tail on the horse and what's happened. I've had situations, had a horse yesterday, I was doing some training with a lady from Canada, came down and we went to Churchill Downs, a beautiful day by the way. We were working on a horse and we were getting some tail movement. Now I know this particular trainer gets his horses checked all the time by the veterinarian and chiropractors that he uses, and so I'm sure that he's going to we made note of what was going on. But when you have that kind of thing, there's always something to think about and check, and it certainly doesn't hurt to do that. when you approach those types of situations. Sarah, you're welcome. I appreciate you giving the response. They're hoping to find someone around them who has a Magna wave for treatments, or they have to invest in themselves and their mother-in-law. Thank you. Try it again. And really, Sarah, what you need to do, and folks, those of you who are with us, if you want to know where you can find a practitioner, go to the Magna Wave site, click on Magna Wave near you, and you can search by state, you can search by name, and it'll tell you who's available to you and how close they are, and if they can help. And if you don't see somebody, let us know, because there's people that travel. They're in various parts of the country at various times, and so maybe we can hook you up with somebody that can help you out if you'd like to have a treatment. So Sarah, thanks for asking the question. If you have some other questions, let me know, and I'd be happy to answer them and approach them at this point. So I was talking about migraine sufferers and what they can experience. It kind of does play into the fibromyalgia situation as well. And then, there's a whole area of, this was quite a conversation I was having earlier, and it was great that I could pull up Dr. Rowan and kind of look at his notes and some of the things that he's experienced with dealing with these types of issues. And that's female disorders, when you're talking about endometriosis, painful periods, painful intercourse, what they're dealing with and what can help. Let's see if we have another question. We do have a question from a gentleman in Finchville, Kentucky. How does Magna Wave work for arthritis in people and pets? Great question, Ed. And really, arthritis is a situation where you'll have a buildup of calcium at the joints, and then that starts to irritate the nerves and the cartilage and the elements of the body that are all connected at that point, and you start getting some pain because of the inflammation, and it gets stiff because you don't have enough fluid there potentially to help those areas. Synovial fluid build up. As we age, we deplete our synovial fluid or our hyaluronic acid that's in our body, and the body replaces it, but quite often we're not replacing it fast enough to help a situation that we're dealing with. And so Magna Wave, what it brings to the table with regard to these types of issues is improved oxygenation. We can help the body take away the inflammation that occurs in those areas and thereby relieve some of the pain that's caused. Are we going to go in and get rid of the calcification? No. That's not going to happen. That's not what the device does. It doesn't break up calcification. Can the improved circulation, if you treat yourself regularly and you have good circulation throughout your body, good oxygenized blood, well-flowing blood, cannot retard the buildup of calcification in those areas? Potentially. I mean, whatever is causing that buildup, is it a deficiency in the body? Is it a vitamin deficiency? Is it something that's going on? Is it a lack of something is allowing your body to be in a state to where it becomes arthritic? It not only is it age, but it can be something else that's causing or allowing that buildup of calcium or calcification that begins to irritate the nerves and the joints in the area and make them less flexible and cause a problem. Can it serve to retard that? Yes, by virtue of good blood flow and good blood oxygenation. So to quickly answer your question again, yes, it can be very beneficial for arthritis and pain-related issues related to arthritis. Let's see, did I have I thought maybe there was another question. Chronic pain from fibromyalgia. Okay, well, that question left. All right, any other questions? Let me know. I'm kind of monitoring over here, so I'm happy to answer those questions for you as we go ahead. So we were talking about female disorders, and there's a couple things that we can discuss here, but Dr. Rowan found through various studies that people with these types of problems, endometriosis, painful periods, etc., have responded with a 90% marked or dramatic relief, 90% relief in pain or a dramatic relief to their body and feeling of pain that they have. Patients receiving PEMF will find significant pain control action and from Dr. Rowan's research, meaning that there are people that go through, women that go through life with painful periods, and so if there is medication that they can take, they can also apply PEMF to their central area of their body and get good blood flow and oxygenation there and give them some relief from their endometriosis or the pain that they're experiencing at that point in time. So certainly we've seen very good result. Also, to that end, when you talk about female disorders, a lot of people, and we've had this in men as well as women, who have incontinence issues. It becomes more of an issue as we age, your bladder, the strength and the muscle, so on and so forth. And my mother used to say, life's grand until you weaken. But that does happen. So life is grand until we weaken, and so we have some of these issues. But we've experienced using the Simi device, the Maya, the Pulse Pro, and even the Max with our type of devices to simply place it over the bladder. We've seen people have tremendous results in better controlling their incontinence situations and how often they need to get up in the middle of the night to go to the restroom and those kind of things. So it's just something that's a support system, helping your body better take care of itself, helping your body better deal with what's going on. We can basically massage, exercise those areas of the bladder, the muscle control, to help things be stronger and better in control of what's going on. So we always find that very interesting when we're dealing with those kind of situations. Men, for example, and we're talking about, we're not talking about female disorders, but prostate situations, if you're inclined or you have a potentiality of having inflammation, PEMF, I do it every day. I get up in the morning, first thing I do is I sit on my couch and I use my Magna Wave, sit on the coil and treat the prostate area. I've had some issues in the past and I want to continue not to have issues any longer, so I treat myself, and it helps keep inflammation down, keeps blood flow good, keeps everything in good place. So there's a lot of things that we can approach and do here, in those types of areas. A question here from Chris. What about Cushing's? I've had a client with a horse who has showed signs and tested positive for Cushing's for 2 years. What areas should I treat? Probably an overall body treatment. I mean, we want to treat the overall body of that horse so it's just got good oxygenated blood all the time. This could be a situation when it's been going on for a long period of time that, again, you're not going to provide great relief after just one treatment. You might see some relief after one treatment, but it's going to take control, much like we experience sometimes with EPM in horses. In some of those cases, the horse needs to be treated regularly, whether that's once a week or once a month, whatever will help sustain that type of good result that you're receiving. I always say my standard protocol is we provide sessions as long as function continues to improve, and then we provide sessions often enough to maintain the function that was gained. And that, you kind of, we reach a plateau, can't really seem to get a lot better because of whatever's causing the situation, but then we want to treat enough so it doesn't revert. It doesn't back up, as I often use in conversations. We want to stay ahead of the issue. Same thing with regard to the Cushing's. So just, I'd say overall body treatment, treat regularly, treat as often as you need to, and hopefully you'll be able to get a good response to what you're looking for. Chris, great question. Thank you very much. Any other questions, folks, please throw them up here, and I'd be happy to answer them at this time. We've been going now for about 30 minutes, and we'll continue as long as we have some input or questions. Another area that we've had a lot of talk about is when you're dealing with areas of tendonitis, with ligaments, areas of problem, and people will use steroids. And so the question comes up, do you have to use steroids? Can you use Magna Wave instead of steroids? Can you use Magna Wave in conjunction with steroids? And what's the best way to approach this? Well, if you sit down and put together a regimen of what you're doing and how you're going to use various medications and modalities in a complementary fashion all which have specific things you're trying to accomplish. And a lot of these various modalities can become very complementary and aid the healing of a particular indication, either a more solid healing or a quicker healing, or a healing that's in pace with what you want to see happen. And we don't want to get into protracted areas or situations where it takes a long time to accomplish something. But there was a study, and Dr. Rowan talked about this as well, as to where the PEMF stimulated the cultured fibroblasts to help the body make collagen. And so that, to make more collagen, and what that does is it showed that the tendonitis, the elbow, the therapeutic, compared to they used PEMF, placebo PEMF, and steroidal injections. And what they found, those receiving PEMF got far better reduction of pain and improved activity than those who had the placebo PEMF or those who had just steroids. So again, complementary application of these various modalities is really the key. People have asked me before, well, you have some supplements on your website, Lubricin and the hydrowave water, and you're talking about adding some other stuff, and what about ozone and all of this kind of stuff, and you know, are you short selling your Magna? No, because I go to these meetings and I talk to these people with ozone, and they'll use ozone and then they'll use Magna. For example, when you're talking about ozone, there's 3 or 4 ways to administer ozone to the body in order to up the oxygen level or continue to up the oxygen level in the body. You can put it in through the ears. You use like little things like the doctor uses, a stethoscope, hook it up to the machine, and it puts ozone locally in through the ears, into the head, into the cranial area, and help that area. It will help the whole body. You can breathe it. Ozone is poisonous, so you have to filter it if you're going to breathe it. So you run it through an olive oil mix, and then you can breathe it through a cannula to ingest it into your lungs and into your body to gain benefit. Or you can use what they call insufflation, is where you take it from the ozone machine into a bag, type of bag, and then you put it into the body either rectally or vaginally through the vagina into the body to get it absorbed into the colon and into the soft tissue of the body. Very responsive. Those areas of your body, because of the tissue makeup, are very responsive, very absorbative of what's there. So you can get a very good absorption of the ozone into your intestines or into the colon of the body, and then it will dissipate into the bloodstream of the body and then do its job that the ozone believers and the ozone doctors that study it see that the results that can be attained by virtue of doing that. What they'll do, where I'm at now with a long explanation, is they'll put the ozone into the body, then they'll use the Magna Wave type of apparatus to help push it in. For example, what I often do, and the full story is I had a issue with my prostate, needed to have biopsies, needed ultrasounds, all this kind of stuff. What I do, I took hydrowave water, I used ozone, I used the Magna Wave every day. 8 weeks later, they went in to do the biopsies. Everything that was the mark that was there on my prostate was dead and basically benign, and so we were very happy with that on a complementary application. Could we have used just one of those? Yes. Would we have had the same results with just one of those? Potentially. But when you use all 3, it just, you're if I'm going to roll the dice, I want to have 3 or 4 dice in my hand instead of just one. And so we look at those types of things. Have there been people, if you look at under the podcast area of the Magna Wave website, under the About tab, you'll see podcasts, and look at the podcast and the webinar that we did with Pilar Davila dealing with her protocols that she used the Magna Wave and some specifically protocols of oxygenation and various supplements and things she took to basically free herself of her I believe she had ovarian and liver cancer that had metastasized, that gave her just a few months to live, and so she's got a protocol that she's developed, and she uses it, and so she used her supplementation with the Magna Wave. And we've seen some very intriguing results when we've talked about and had people with various problems and various indications that they've used the Magna Wave on and had we don't treat conditions. We don't provide services for conditions. We provide services to help the body better heal itself. That's all we're doing. We're creating an energy that we put into the body and let the body better respond to it, and hopefully have things work out. So, there's my whole story, but that's what we deal with when we start looking about complementary methods and how things can be done for your health and wellness. I believe we have another question. What is the time frame suggested for a PEMF treatment after massage, chiropractor, whether human or equine? Well, great question, Judy. Appreciate that question. And so, to be clear, she's asking how soon after chiropractic or a massage can you use Magna Wave? The reality of it is you can use it immediately if you so desire. Quite often when we're dealing with chiropractic, and whether you're talking about a person or a horse or a small animal, whatever it may be, the chiropractic is to get them back in alignment, keep them in alignment so they don't have additional problems, and then allow things again to be in position so the body can not be inflamed and not have problems. Well, quite often, so they'll do a chiropractic adjustment on a horse, let's say, and then we'll come in after that adjustment and help relieve some of the inflammation. They can put the body back in alignment, and they're going to put it in a situation that maybe the inflammation will start to relieve itself, or it will not occur as quickly. But there's a lot of stuff going on there that we want to help relieve immediately or as soon as we can. So if we can get rid of that, help the body get rid of that inflammation, that will help the chiropractic adjustment potentially last longer, give you more relief so you feel better. So when you go back and get the next chiropractic adjustment, because quite often you'll do one a week or one every day or one every other day to where they get you to where you're totally in alignment. If you have some support, complementary methods going on that can help that as you're going along, your results are only going to be better and give you better health and wellness. Same thing for massage. Now, it's a little different for a massage, I'm going to say, because we're basically providing a mechanical movement of the muscle tissue of the body, and that could be, some would say, very similar to a massage. But even with a massage, if they're working out deep muscle issues that you want to have, quite often after a deep tissue massage, you're a little sore and then you feel a lot better. Well, the Magna Wave can help with that soreness and then help you feel better a little more rapidly. If it's an animal and it's got some serious issues and you're using the magic of hands-on massage to make all of that better, again, you might want something afterwards to help fully invigorate the whole body, to invigorate the good blood flow and oxygenation to help the overall well-being of the animal, person, or large animal. So, great question. You could wait. I mean, you do a chiropractic. You're not going to reverse anything that's occurred. Let's put it that way. So, if you do a massage, chiropractic on your dog or your horse or yourself today, and you've got low back issues that are there all the time, so you want to wait till the next day to continue to work on your low back issue before your next massage, absolutely. You can wait till the next day. However, the sooner you approach something, the better off your result is, and the better off it holds. And that's what a lot of this has to do with, is how long the treatments hold. How well can we help what's going on last a long time. That's what we want. We want instant gratification, and we want it to work well and last a long time. and you know, that type of thing. So that's what you're looking to have. Let's see here. Would a dog, let's see, another question. What would the protocol for a dog with focal seizures be? I will add that he is not on meds. He has had 5 seizures in the last year with no pattern. Lab work is normal. Well, you know, it's interesting. We had some people responding to our, and I probably need to go there and look at this, but seizures, treating dogs with seizures. And again, the overall thing that you might want to do is you're treating the full body. You want to treat, you know, the neck and the lower neck areas, so there's good flow there, and there's good calmness of the nerves and the muscles to aid in those types of situations. If it's not a regular thing, and again, you want to work very closely with your doctor or your veterinarian if you have somebody that asks you these kind of questions, because you want to make sure that you're operating within guidelines that they would want you to operate in, and you're not doing anything that would be different than what they want to see happen. But as a rule, you're going to talk about, again, as we often do, the full body or the head, neck, and shoulders type of treatment to help the whole area and to hopefully provide some relief. A lot of times, I don't want to say they're stress born or what's happening, but if you can create that overall well-being and wellness within the body to better take care of itself, over time you might set the body up to where whatever's causing those types of seizures isn't present or isn't there to cause that to step over the line, and bingo, all of a sudden we have a question. So hope that helps there, but full body, you can't hardly go wrong with a full body type of application in that situation. Also have a client with a horse with anhidrosis. I treated her twice and she was sweating on her next session. How often would you treat to keep her sweating? She has also been on True Sweat for over a year and they couldn't see a change until PEMF. Very exciting. And we've heard that type of thing before. There are methods that we've used utilizing the paddle to treat the chest and the shoulder and the neck area of the horse to open up the pores, to basically get good circulation into the pores of the body so they can be in a position to better sweat. Anhidrosis is a situation where a horse, when it works, does not sweat. And it keeps a lot of that tension inside, and it keeps the heat inside, and it doesn't allow itself to cool off as rapidly. And there's many different causes and many different situations that they say bring that on. I don't have that problem as a person. A lot of people don't, but I guess some people don't. They don't sweat when all I do is go outside and act like I'm going to do a treatment, and I start sweating. But no, I don't care if it's wintertime or summertime. I'm just there because I get going and I do my thing, and it's there. But on a horse, you would treat. It's a good question. How often would you treat her to keep her sweating? She's going to tell you that. The horse is going to tell you when the problem is once again beginning to take control. The fact that they were on a supplement for sweating and not seeing much change, but the supplement was in the body and you were just there at the right time to help activate what they're setting up, or hoping that this supplement would allow to happen. You just kind of brought things along with the overall help of the pore makeup of the body. You see, Magna Wave, if you're doing something in the way this is kind of think about this, and we talk about blood and circulation and all that, but really you're energizing the body. It penetrates everything. So when we go in, we're not going in and just treating that point on the knee or the hip or the elbow that's hurting. I kind of talked about this, and I'll go into this, but basically when we're going in and treating the whole area, we've got to get through the skin. So we're actually treating or giving a session to the skin as well. So if you put something topical and then you treat it, we're going to help push that topical through the pores, into the tissue to get it set up to do a better job for what it's designed to do for the body. So same thing when we're talking about sweating. When that horse won't sweat, the whole system, the skin barrier system, is causing like a wall, like a wall to keep the water from coming through, or a piece of plastic to keep the water from coming through. So we want to work that whole area. We want to open up through the vascular system, everything from the pores of the skin all the way to the sweat glands, massage them. And they talk about dry eye to get the massaging of the tear ducts of the eye to help them so they don't clog, so you can have better tearing of the eye, which is natural for blinking and that type of thing. We've seen results there as well, where you can hold the coil up, treat your eyes, and it helps massage all those areas that become a problem for tears, people that have a problem with tearing. Same thing on sweating. You might do it a couple times a week just for the first time and then stop and see how the horse does. And the horse will tell you, as I shared with my wife, with her back. We had to treat her for 30 days. We got a couple of weeks worth of relief. Treated her for another 30 days, got 4 weeks worth of relief. treated her another 30 days, got 4 weeks worth of relief, and that's the way it's been for now for 12 years. Every 3 to 4 weeks, we need to treat her back 1 or 2 times, and then she's good for 3 or 4 weeks. So you could very well take those horses to that same type of situation, but it could take a little while for the whole system to become balanced to where the horse responds to the exercise and the supplements that they're receiving on a standard, normal basis. Great question. Let's see, abscesses that is draining. Gosh, a lot of good questions this afternoon. I love that. I appreciate you asking the questions. So let's see. What would your recommendation be for treating a horse with abscesses that are draining? Well, certainly, we're quite often used. An abscess is like a boil that's in the foot of a horse. So the foot of a horse is very contained. It's like basically the fingernail all the way around the foot. And so they can get a sore down in there, much like we can get an abscess, a boil in our mouth or somewhere. And so you have this boil, and it's got to come out. It's got to be relieved. And so, but what happens on a horse is it gets in that foot and it gets clogged up and it can't go, but yet it's growing and causing pain to where the horse can't put pressure on it. It has all these situations. Well, what we do from the Magna Wave perspective is we'll use the butterfly loop, or we'll use the Zoom paddle and box, and we'll put that foot on there, and then we're massaging that foot. We're stimulating that foot with energy from the bottom up, trying to push the energy up the leg, which is easier than trying to push it down and then back up. So we're trying to massage the whole area around where that abscess is to get it to where it pops or releases and can free up the area. So if it is draining, you can treat the same area to enhance the draining, get it cleaned out, get it going. Typically, when you reach that situation, they'll pretty well drain on their own, and then they'll bandage, they'll do whatever they need to do to clean the area up and make sure it's good and get the horse about for their full recovery. But if it's it's still oozing and you still got some stuff going on, you could certainly use the box and paddle, or use the butterfly over the hoof. Basically, you put a butterfly here and here, and you're treating the whole area just to continue to nourish the circulation in the area, nourish the blood flow in the area. Now, if it's bleeding, which an abscess releasing is not necessarily bleeding at that point, but if it is bleeding, you don't want to do anything. You want the bleeding to stop, and then you can treat to help stimulate the body to better heal itself. And so you can take it from that situation. We improve blood flow. We don't increase blood pressure. So if the blood is flowing, you don't want to do anything. You want it to stop, be in control. Then we want to nourish the area for better healing. Great question. And I thank you for Krista for asking the question. Any other questions, folks? I'd be happy to answer them for you at this time. It's been a good visit with you at this point today. Several people are with us, and I'm sure others will pick it up and watch it over the period of the next day or so to learn more and hopefully get their questions answered here on the Magna Wave Office Hours program. Well, it looks like things have kind of slowed down here. If you do have a question, I certainly would like to answer it for you. Franz, thank you so much for being with us today and asking your questions. If you have any questions, let me pull this up here. If you have any questions, please feel free to, nope, not that one. Let's see, which one is it? Well, I don't know, I can't see it. I was going to, here we go. If you have some questions and you'd like to present them, please feel free to send them to magnawave1@gmail.com, and I'll get them, and then I'll have them for the next program. You can call the office at 502-742-7868. We'd be happy to take your questions there. You can send us a Facebook message, and that'll have a way for us to get the messages. So, and this is for the office hours questions, or if you have something that you'd like to see me cover in a Magna Wave Minute, I'd be happy to do that. So just send those questions to us, and we'll answer them in that type of situation, or we'll answer them for you as you ask them. So let's see. Yeah, Brianne, thank you. Thank you for taking the time to answer the questions. But she says she still learns a lot from the questions. Brianne, thank you so much, and we certainly appreciate being here. So that's it for today. We'll see you on a Magna Wave Minute. We'll see you on the webinars on Thursday afternoon at 2 o'clock. Didn't have one last week, kind of got behind the 8 ball, but we're looking to bring very good learning information to you on the webinars as well. So thanks for being here, and we'll talk to you next time. Have a great day. Bye. Oh, looks like I'm back, but I'm not back, but I'm going away. So we'll see you next time.